Hi, this is Sarah Reese, Polk County Public Health Director, and I'm here to provide you a COVID update. It is September 17th, and it's a privilege to be visiting with you today. Today we did our weekly update, and we currently have 257 cumulative cases of lab-confirmed COVID in Polk County. With that, we also had an increase of 30 cases this week, which represents the highest one-week increase that we've had since the start of COVID. With that in mind, I'd like to take a moment to talk about isolation and quarantine. With back to school and people moving about for lots of different reasons, it's important to be mindful about isolation and quarantine, and we've heard people using it in a variety of different ways. So want to make sure that we clarify the difference between isolation and quarantine. So isolation is used when someone is sick. So when someone has a lab confirmed case of COVID or is sick with COVID-like symptoms, isolation is used, and we ask people to stay home during that time when they are infectious and could be getting other people sick. And so the idea is that they would, even within their household, try and stay away from other people during that time. So the key thing about isolation is it's for people who are sick, and we want them to stay home at least 10 days from the time that they started getting symptoms. At least. And that's important because sometimes people have symptoms greater than 10 days. So we say at least 10 days. We want 24 hours where folks have been fever-free without using pain-relieving medication. And importantly, we want symptoms to be improving. So those are the key pieces about isolation. And remember, this is for someone who is sick. Then a little bit more difficult to understand and remember sometimes because the words are used interchangeably, we have quarantine. And I like this handy dandy map that we have from the CDC. So quarantine is used by someone who has had a close contact with someone with COVID-19. So someone who is a close contact, we would also ask them to stay home, and we would ask them to stay home for 14 days. And the reason for that is because during those 14 days is times when we could be seeing the symptoms arrive. And so as you can see on this example, the last close contact with the person who had COVID-19 was on the 1st in this calendar example, and then we're looking for 14 days after, which would be the 15th. So that would represent the last day of quarantine, then returning to activities on the 16th. Currently, the Minnesota Department of Health asks or recommends that individuals who are close contacts to request and to see their medical provider or a COVID hotline through their health system to be tested for COVID around day 5 to 7 after that last contact. So just to be clear, we have isolation over here, which is for individuals who are sick. And so we're looking for staying home and away from others for at least 10 days. And then over here, what I just visited about was quarantine. And quarantine are for the people who are presumably well at the moment, but we're wanting them to monitor their health. And that period of time is, as I mentioned before, 14 days. And it's really important that even if you have a negative test, that we still have the 14-day period, because sometimes those symptoms present later and sometimes they present earlier. Every person, of course, is different. So thank you for letting me have a moment of your time to talk about the difference between isolation, which is for individuals who are sick, and quarantine, which is for individuals who have had a close contact with someone who has had a positive lab-confirmed case. Having said all this, it's a lot of information. So if you find yourself in the situation where you have COVID or you are identified as a close contact, Polk County Public Health will be in contact with you to provide you more guidance about your particular situation. It's always our pleasure to answer your questions, so feel free to give us a call. Thank you and have a great day.